Hey everyone, welcome back to another episode of Expanding Access Podcast, recorded live at the Behavioral Health Tech Conference in Arizona. Today, we have the privilege of hosting two outstanding guests. First, I want to introduce you to Ben Lawrence. He's a Director of Clinical Operations, Risk Identifications, and Outreach at HCSC.
Hi.
We also have Ben Kurian, who is the Executive Medical Director of Risk Identification and Outreach for Behavioral Health, also at HCSC. And for those of you that don't know the acronym, it's Health Service Corporation, Blue Cross and Blue Shield plans. I'm excited to have this podcast with them to really dig into some of the outstanding work that they're doing. So to begin with, gentlemen, what brings you to the conference?
I think we're excited about all the innovation in technology, learning more about the collaborations that are possible and how we can expand access to care.
Love it.
Yeah, I would agree with that. It's first one of these types of conferences that I've been to, and really exciting. Our program in particular does a lot of, I would say, innovative things. So we really felt like the purpose of the conference fit well with our program. So we're really excited to see what kinds of things we could take back with us.
That's awesome. That's awesome.
Yeah.
Thanks for sharing, guys. So tell us about yourselves and about the company.
I'll start off. Yeah. So again, Ben Kurian. I'm a psychiatrist by trade. Current role at HCSC is Executive Medical Director for the Risk Identification and Outreach Program for about the last 5 years. And prior to that, I was a psychiatrist and primarily doing seeing patients and doing clinical research for treatment-resistant depression and anxiety disorders.
Yeah. Thanks for sharing. Ben?
Yeah, I'm Ben Lawrence, the other Ben. We like to joke about that a little bit. So I have been with the RIO program with HCSC for about the same time. We both started the program and kind of were in the developmental phases before we got live. So about 5 years. Just celebrated my 14th year with HCSC. So found a good home there, really enjoy the company and what they stand for. Prior to that, I worked in another managed care job for a few years. I've also done some private practice counseling. I'm a licensed professional counselor by trade.
Cool.
So I did some private practice counseling. I've done some community mental health work, but primarily spent the bulk of my career in managed care.
Excellent. Excellent. Well, super excited to have you guys here. Tell us more about HCSC's Risk Identification and Outreach Program, also known as RIO.
Yeah, I'll take that question. So RIO started, we went live again in July of 2019, so just celebrated our 5th year. RIO is largely a case management program. So we've got one thing that makes us unique is we're multidisciplinary in the way that we're constructed. We've got dedicated medical directors. Dr. Kurian is our executive medical director. We've got a couple others that work under him. We've got some dedicated pharmacists. We've got 2 teams of dedicated clinicians, behavioral health clinicians and medical, registered nurses. We've got some support staff. We've got some dedicated data and analytics staff. All together, we're probably about 40 strong. The thing that sets us apart from a traditional case management program is we're data-based. So we look at data from various different resources, whether that's claims-based data, pharmacy data, ADT data, just a variety of different resources. Let that kind of tell us where to go and move in terms of our member outreach, which populations are going to be the most clinically actionable, and then we develop programs around that. So mentioned that technology is a big part of what we do, and that's kind of that piece of it, yes. But really letting that direct us in terms of who are we going to outreach, and then go back to the data to let us know, are we doing what we set out to do? Are we doing a good job at it? So that's really in a nutshell. So we've got 3 main cohorts that we've launched, 2 in the opiate space, 1 in the untreated depression space. And then we've got a new cohort that we'll be launching in January that Dr. Kurian will tell us about in a little bit. But really exciting work. We love it because it's innovative. We're a small enough team that we can be nimble and kind of change on the fly when we need to. And we've got just a great group of folks on our team that makes the job really fun for us.
That's great. Thanks for sharing. Dr. Kurian, you want to add anything to that?
No, Ben, you did a great job addressing it. The only other thing that I would add is, as Ben mentioned, we're data-driven, but we really like to focus on conditions that have both a medical and behavioral health comorbidity. So we know, for example, like you talked about untreated depression, we know that diabetes and hypertension has high comorbidity with untreated depression. So those are the types of patients that we try to reach out to. And given that we have clinical staff with have both expertise in behavioral health and medical expertise, I think it lends us a unique capability to try to meet patients where they're at and try to navigate their care journeys.
Oh, fantastic. I
Yeah.
love that. Yeah, those comorbidities are really problematic.
Yeah.
And so great to catch them before it becomes something bigger. That's fantastic, gentlemen. What are some of the challenges you face with care coordination, and how are HCSC and RIO addressing them?
Yeah. So one of the biggest challenges we face is actually being able to successfully reach the member. So we get data feeds multiple times weekly with members that meet criteria for whatever the cohort is. And then we will assign those out to our teams of case managers for outreach. But one of the bigger barriers is actually successfully reaching that member. Are they going to answer the phone? Are they going to call us back if we leave a message? Those kinds of things. So we're really looking at ways that we can expand our methods for outreach. So we're looking at things in the digital space. Can we text these individuals? Can we send them emails? Which sounds, I mean, we're in the year 2024. Like that sounds like that's not that new of a thing. But when you're talking about things like protected health information, sensitive topics like opiate medications and potentially dangerous, whether it's self-harm behaviors, things like that, things that are protected under a variety of different laws. You can't just send somebody a text to say, hey, call your insurance company about this. So we have to be sensitive to those things. We definitely want to protect the member's identity and health information, but at the same time, make it easy for them. Yeah. So, it's problematic when we have to we send a text and they have to sign in through some sort of password code, and then and you have different loops and things to go through. It's difficult, right? It's not user friendly. So those are some of the bigger challenges that we face, is making it user friendly, but also respecting things like health laws and privacy laws and things like that. So I don't know, did you have any other?
No, yeah. The only other thing I'd say is there's so much access. I mean, you and I probably get 1 million texts in a year. Knowing which one of those are actually spam or actually can be useful. So I would just put a plug out there. If you get a text from your health insurance company, don't disregard it. We're there to try to help you. We're not asking you for a payment. We're trying to help. Yeah.
I love that.
Absolutely.
Great call out there. Yeah, it's a good reminder to all of us, right? If our plans are trying to get in touch, let's do our part and reply. There's likely a good reason they're reaching out for that. What exciting developments are on the horizon for HCSC and RIO?
I'll talk a little bit about that. So we're really excited. Ben talked about a couple of our cohorts in the opioid space. One of them is we partnered with the American College of Surgeons, which basically they're the board that any surgeon that you go to that does a surgery, they're the governing board for those surgeons. And they're very interested in some of the same things that we're interested in, basically increasing safety for our members or their patients around the time of surgery. So I'll give you an example. A part of this partnership, we're looking at ways to educate our members on non-opioid pain management techniques that they can use prior to, at the time of, and after surgery. And that's something that they've been doing, educating surgeons and their board about as well. And there's a variety of non-opioid medications, techniques, and other things that patients can do. So that's part of this research study that we've collaborated with them about, and we're excited. We just finished enrollment for that study, so we're working with them on analyzing the results of that data, and we're hopeful we'll be able to publish that in a peer-reviewed journal to provide education for our members on other things that they can do.
That's fantastic. Yeah, because those opioids are still a problem.
100%. Yeah. I mean, there's a time and a place for opioids.
Totally.
And in an acute pain setting can be one of those times, but a lot of people don't want to take opioids and they have side effects from them. For myself, I have side effects when I take opioids, so I can't take them. I don't like taking them. So it's helpful to know what other things you can do, other methods and techniques and medications you can take that may not have those side effects.
Yeah. And thinking about what we're discussing here, behavioral health, mental health, substance abuse.
Absolutely.
If we could catch things like that downstream,
For sure.
is there a portion of what you guys are doing because of that?
Yeah, no, absolutely. I think that that's one of the things when we first started. Ben, you can talk a little bit more about that. But when we first started RIO, it was under the guide or auspice that we would try to identify members that may be at risk for opioid use disorder so that we could reach out to them and help them get treatment if they so desired. Yeah.
I love that.
Yeah, and just to add one more quick thing on the opiate side of things, our first cohort that we launched was an acute opioid initiative. So looking at individuals that had been on opiate medications for a long time, maybe receiving those from multiple providers, maybe on dangerous combinations of medications. So kind of looking at that acute side of things. But then we rolled out a sister cohort the next year that was kind of looking at the other side of the same coin. So looking at individuals that maybe hadn't been on opiate medications, but were going to have a surgery, going to have some sort of medical procedure that would likely have as part of their post-operative pain management an opiate prescription. So ideally reaching out to those members before they have that procedure, talk to them about, have you thought about taking opiate medication? Some of the things that Dr. Kurian just shared, have you thought about what your post-operative pain management strategy is going to be? Have you thought about supplementing or maybe augmenting with over-the-counter medications? Those kinds of things. So trying to prevent long-term opiate use.
Fantastic. I love to hear the initiatives, the thoughtful approach, the intentionality, and the teams that you've put together, the models that you're employing, the partnerships with the American College of Surgeons. Like, you guys are really all in on this.
Yeah,
100%.
yeah. We enjoy it. It's good work. Yeah, it's rewarding as well.
And I think it's important to partner with providers because we're not, as an insurance company, we're not here to dictate terms of your treatment, but we do want you to talk to your doctor and help you have those conversations so that when you go into the surgery, you're more well-informed about what that's going to look like and what that post-operative plan is going to look like.
Yeah, I love it. I love it, gentlemen. Well, look, this has been fascinating. The topic of the name of the podcast is Expanding Access. You guys are certainly doing that with the work you're up to. As we close the podcast today, what do you want to leave our audience with in terms of a closing thought? And where can they reach out to you to learn more?
Yeah, I'll start out. Closing access in mental health space is so important. And 100%, I think that's why we're all here at this conference. This conference is doing a fantastic and phenomenal job of increasing awareness about what is available, what's coming, and how health plans can partner with providers and technology to provide better options for our patients. So one thing that we're super excited about as we come into 2025 is we're looking at new initiatives and new cohorts so we can identify members that are at risk and not only identify and outreach them, but then get them connected to care at the time that they need it. So that's something that's coming. As for where you can find me, I'm on LinkedIn. It's probably the easiest place you can find me, and feel free to connect and reach out. Would love to talk to you and discuss ideas.
Outstanding. Thank you, Dr. Kurian. Ben?
Yeah, I would echo everything Dr. Kurian said. I would say things that we're excited about. Like I said, we've got a 2025 initiative that we'll be rolling out that's looking into a new space of member safety. So much of what we do has to do with harnessing the technology that's available, but also looking at down the road, how can we make new technology work for us? How can we do it in a timely way so that we're reaching these members at the most opportune time, which is huge. So yeah, super excited about what the future holds for our program and for HCSC as a whole. For reaching out for me, I'd say you can look me up on LinkedIn as well. Yeah. So thank you very much for the opportunity.
Oh, yeah. It's a pleasure to have you gentlemen here. And for everybody that wasn't able to attend the conference, that's why we're doing this podcast, to help you expand access as well. In this episode, it's been incredible to speak with Ben Lawrence and Dr. Ben Kurian, both from Blue Cross and Blue Shield plans, the Health Service Corporation. I'm excited to really share all the ways you can get in touch with them through their LinkedIn, as well as their website. We'll share that in the show notes. Make sure you take action on what you learned today, and really appreciate everybody tuning in. And gentlemen, thanks so much for doing this.
Thank you.
Thanks for the opportunity.